was Thursday, May 7th. We started out the week with Monday, May 4th. May the 4th or Force be with you. And Tuesday was Cinco de Mayo and Taco Tuesday. And today is Thankful Thursday. And we're so thankful to have Dr. Sheba Roy back with us. She was with us 2 weeks ago and talked about integrative oncology and wanted to share some more tips, suggestions, ways to care for ourselves, not only during COVID-19, but concerns that breast cancer patients have in particular during this time. So Dr. Roy, I'm just going to let you lead. And if I have a question, I'll raise my hand and interrupt. How's that?
That sounds great, Molly. It's excellent to be back with the Pink Fun today. I think one of the things that we didn't have time to talk about last time was what are the factors in risk of recurrence for breast, and how during this time, especially with changes that patients are having in terms of treatment delays, how we can lower the risk of recurrence during this crisis. Is that right?
That is correct. And just for those of you who have not heard Dr. Roy before, Dr. Roy, would you please introduce yourself and describe what the acronym after your name means?
Yeah, so I'm a natural medicine doctor, but I'm a fancy kind, I like to say. I have both the conventional medical training and the training in natural therapies. My medical license is in Vermont, and in states like Vermont where I'm licensed, I prescribe drugs, deliver babies, do minor surgery. But in the state of Michigan, natural medicine doesn't mean much. Anybody can call themselves natural, integrative, holistic. That doesn't really mean anything here because those terms aren't licensed. In the state of Michigan, I practice as a consultant. I am what's called a fellow of the American Board of Naturopathic or Integrative Oncology. I'm technically an integrative oncologist, which means I am a bridge between conventional therapy, natural therapies, and nutrition in a cancer population. So my job is to partner with you and your oncologist in finding the right natural therapies and the right nutrition to lower the side effects from chemotherapy, radiation, and surgery. And once we're in survivorship, to lower risk of recurrence or slow progression.
Great. So I know that during this time, many cancer patients, whether it's breast or otherwise, or patients with other challenging diseases, are being told to stay home unless they really require an ER visit. And so there's a lot of anxiety around that, particularly when you have a cancer that you think could be growing while you're not getting treatment. So why don't you share about this risk of recurrence that could extend progression for these patients and what they can do?
Yeah. So first of all, it's really important to partner with your oncology team and talk about those fears and those concerns. For the good news is for most of us with estrogen, progesterone positive cancers, they're usually slow growing. So even with a new diagnosis, we usually have a little bit of time. But that doesn't mean that you should delay all treatment. So for newly diagnosed breast, we like to see patients start on hormonal therapy right away, so we can at least introduce something that normally is introduced later on to slow cell growth. For patients who are getting chemotherapy, radiation, we usually can't stop those treatments. So it's important to continue with them, but make sure we're following protective guidelines during that time. So can you still see me, Molly?
I can. And maybe you could describe what protective guidelines are, not only for the patient, but for the provider.
So for protective guidelines, that would involve things like making sure that when you're going to oncology, you're washing your hands beforehand, you're using a mask, you're making sure that when you get to the hospital or to the clinic, that your providers are using masks. Usually hospitals and clinics right now are really good about offering precautions. So it's really not something that you need to worry about so much as you need to worry about when you go home. So when you go home, it's really important to throw your clothes in the laundry right away, take a quick warm shower, shower, and make sure you wipe down all high-touch surfaces like your doorknob, your doorbell, your all of those kinds of things, the light switches when you first walk into the house. So as far as taking precautions, that's the best you can do right now. It's important also to wear a pair of glasses. You don't need to wear goggles. You could wear a pair of glasses with frames that don't have a prescription in them, or sunglasses are also okay. It's easier to not rub your eyes if you're wearing glasses. It's easier not to get water droplets in your eyes from other people.
That's a good idea. I was at the airport in early February, and there was a young man who actually had on a full mask and swim goggles on right before everything fell apart. And I found
That is funny.
amusing.
Yeah, at least he was well protected.
He was concerned, and he was taking the best protection that he could at the time. So I have a question. Two things. What about women who feel a lump and it's palpable, and they're told to wait for a mammogram?
That's really hard. So patients who feel a lump that's palpable, who are told to wait for a mammogram, if they are our patients, we usually have good enough relationships with oncology that we're able to work things out. So sometimes that means pulling some strings and getting them in sooner. Sometimes that means using alternative options to evaluate the lump. So getting them in with gynecology right away, getting a physical exam and an ultrasound done. And sometimes it means using some aggressive natural therapies and working on anxiety while we wait for a mammogram to be available to them. We shouldn't wait with a new lump. We shouldn't wait longer than 6 weeks. So that can be super stressful. And managing anxiety during this time is huge, Molly. We have on our staff therapists who are trained in anxiety, depression, and grief associated with oncologic diagnosis. That's all they do. Helping patients with breathing techniques, with distraction, with cognitive behavioral techniques, with sleep disturbance, so that they can get through this time not feeling as stressed and overwhelmed while they're waiting. Again, most breast cancers are hormonal positive, so they've already been there for quite some time before we even see them on imaging. They could have been growing for 5 to 10 years. So while that may still feel terrifying, this isn't something that's going to kill you today. And I know that language can be super stressful, but it's what's in people's minds. And I think it's important to name it. It is something that usually has some time to treat.
So you mentioned that if you have a positive diagnosis of breast cancer, that one of the options is to start with the aromatase, if you're ER positive, right? To start, which is estrogen receptor, for those who don't know what that stands for, is to start with those aromatase inhibitors pre-surgery. Is that correct?
Yes. So they can be used for tumor debulking, meaning they can shrink that lesion small enough where surgery can be most effective. So the typical course of treatment, as most of you know, is you would usually get surgery first if it's a small enough lesion. But the goal with surgery is to end up cancer negative, meaning to end up not having cancer, to remove that lesion so that all evidence of disease isn't there. And what you want are negative margins. So in the tissue that's removed, you want no cancer on the outside of that tumor burden. So hormonal therapy can help to shrink that lesion, even a small one, to the point where surgery can be more effective. Now, it isn't standard of care to start hormonal therapy early. It's usually used to lower risk of recurrence, which is what we're going to get to today, after completing treatment. But it's a nice way to get started before surgery so that we still have some effective care, and to combine that with natural therapies to lower that risk until we can get into surgery. Because the biggest trouble right now, Molly, is not getting into chemoradiation. The biggest hardship right now is getting into surgery.
Okay, so I'm raising my hand because I have a question. So you have a positive biopsy and your doctor is going to delay surgery. You must advocate for yourself and ask about, if you're ER positive, would you consider or will you prescribe hormonal therapy for me while I wait 6, 8, 10 weeks for surgery?
So I think you used a really important term, and I think this is a key piece with any diagnosis, but particularly with cancer, is advocacy. You have to be willing to be the squeaky wheel. The squeaky wheel gets the most oil, and I think patients often feel if they're polite and they're reserved and they keep it to themselves, they actually will do better. But that's not true. Data shows us that outcomes are actually associated with patients that do bug their healthcare providers. Now, we have to keep being polite, and we have to make friends with our staff and recognize that people are overburdened. But I think being polite, firm, and also making a lot of noise is the best approach, even with a diagnosis not under these conditions. Those patients just tend to have better surveillance, better relationships with oncology, because oncology is concerned about risk associated with dropping the ball, just like everybody else.
I know for some individuals who are introverts or quite shy or concerned about expressing an opinion, would it be appropriate to ask your spouse or partner or best friend, somebody who would advocate for you, to go in front of you and say, look, so-and-so, Mary is concerned about this,
Yeah.
asking on her behalf?
Yeah, of course. And we actually have patients who are further along in their journey in our practice who are designated patient advocates. So if you don't have a partner or a friend to advocate for you and you do need advocacy, you should get in touch with us. I should have mentioned that our website is AIM, as in Associates of Integrative Medicine, natural.com. So AIMnatural.com. And if you contact us through there, we can connect you with patients who are much further along in that journey and are trained in advocacy, who can help you talk to your oncologist. But oncologists, just like everybody else, are people, and they're just as overwhelmed by the fact that they can't get people in the way that they want to. Humanizing yourself, creating that relationship, pushing is always to your benefit, always. So I want to talk a little bit, though, Molly, before we run out of time again, about how you can lower risk of recurrence during this time, even without or even with conventional management, albeit not standard of care. Would that be okay?
Absolutely.
Okay, good. So I think there's a lot of confusion about what actually lowers risk of recurrence with cancer. And the wonderful thing about breast cancer is it's really well studied. So the data is stronger with this population than it is with other populations. And I want to emphasize, even though we may not have a lot of guys listening, that breast and prostate are pretty analogous, meaning they behave similarly in both groups of people. So we can extrapolate the data or extend it to that population. And I want to start with the one that everybody has the biggest questions about, which is diet. So a lot of times we find that oncology tells us eat whatever you want, or it doesn't have an impact. And that may be true during chemotherapy, but it's not true when we are trying to lower risk of recurrence or slow progression and survivorship. So we're taking that data and applying it now when we have treatment delays. Does that make sense?
Mm-hmm.
So
Am I going to like what you say?
what's that?
Tell me that I have to limit my diet. I'm waiting.
Not actually. I do think that it's really important to know what the rules are. So again, there's so much misinformation out there, and there's very simple rules that we can follow. One is to eat a little bit less. You know, as a society, we tend to eat more, and our plates are getting bigger and bigger and bigger, right? But if you have a grandmother's china set that you inherited, or a great grandmother's, you know, those are little tiny dining plates, right? Or if you went to the Detroit Opera House recently, you might have noticed, not recently, but in the last year or so, you might have noticed that the seats are really small. And that is because people were smaller, people did eat less, and that has changed over time in this country. So eating less is really important. Eating and making sure that when you look at your plate, that at least half of your plate, if not 3/4, and you can really literally imagine it divided into 4/4, at least half or 3/4 is fruits and vegetables, and the rest is what you normally love to eat. So switching it up, instead of having your side dish be a vegetable, your main dish is a vegetable, and your side dish is the pasta, for example. Does that make sense?
Yeah, we eat primarily organic at home and don't eat a lot of meat. So we have a pretty good diet. Everything's pretty fresh. But I do know that often cancer patients are looking for something that's quick, that's comfort food, right? So macaroni and cheese, or if they can drive through a drive-through, they're going to pick up a Big Mac. They really go for what they call that bliss factor, the salt, sugar, fat. And what you're saying is we need to get away from that and really brighten up our taste buds to enjoy new flavors and tastes.
I think it's more than that, Molly. I think it's thinking of food as medicine. I think it's really thinking of what kind of things can I do to empower myself in this journey and radically changing that relationship. You know, for myself, for example, I have a pretty unhealthy relationship with food and have had a lifelong struggle with disordered eating. But once I recognized and started to really see in my patient the radical changes we were able to achieve by combining nutritional efforts with medicine, I realized that my relationship was really about stress and anxiety and how I don't manage that well. It's not even about food. So if we start with how we manage stress and anxiety, and we start to shift what we go to when we're stressed, instead of it being food, being something else that makes us feel good and we can still get that endorphin release that you and I talked about in the last interview. I think that we can start to make better choices. It gives us a little more room to make better choices. And if you can't, it's okay. So if you're going to have the macaroni and cheese, fine, but make sure you're chopping up a lot of broccoli and putting it in there. Or you're putting in a little bit of kale, or you're trying to consciously think about putting a fruit and vegetable in every meal, even if it is a Big Mac. Does that make sense?
Yes. So let's just quickly give a quick 3 meal a day diet, just something really simple that people could do, starting with what would be a good breakfast, simple, easy, healthy.
So cancer fighting breakfast would be or an organic oatmeal with a non-dairy milk, some fruits, some nuts, and 1 tablespoon of ground flaxseed or chia seeds. If you wanted to add spices, any spice that has a smell to it is a cancer fighter. So we call those aromatic spices. So pepper is a cancer fighter, salt is not. So cardamom, cinnamon, 5 spice blend, anything you like can go in oatmeal and it'll be a cancer fighter. So that's a good breakfast. If you don't like fruits and vegetables, you can put in a berry powder. So you can get a whole powder from Whole Foods, and it can even be a cacao, although a blueberry or an acai is a better choice, because you'll get that really dense phytochemicals. Phytochemicals are excellent cancer fighters because they're highly pigmented, and there you've got it, a cancer fighting breakfast. It's actually food as nutrition. Food as medicine. Does that make sense?
What about honey? What if you have a sweet tooth? Would honey be okay on the oatmeal?
Raw honey would be excellent for you. It's got a pretty low glycemic index. Maple syrup has a pretty low glycemic index, or date sugar has a pretty low glycemic index, but you want to keep it on the lower end. It's not sugar that's a big factor. It's more how you use fat and sugar. So I want to get to that.
Okay.
I want to finish answering your question, and then I want to kind of move over risk of recurrence a bit. So a good healthy lunch would be something like beans, legumes, lentils, more on the Mediterranean side, with lots of onions, garlic. And you could have a big bowl of that with some greens on the side, or even a gluten-free bread. That would be a cancer-fighting breakfast for breast cancer and prostate, because beans and legumes have a high amount of phytoestrogens in them. Phytoestrogens have a bad rap because there's the word estrogen in the title. In reality, what they are estrogen modulators. So estrogen is kind of an umbrella term for 16 chemicals. Some of which are cancer causing, some of which are cancer preventive. And phytoestrogens shift you towards cancer preventative or protective forms of estrogen. So they're estrogen modulators. They don't compete at 2 cups a day with endocrine therapy, and they won't upregulate estrogen in breast tumors. And then for a good dinner, I would aim for a really big bowl, like a big salad bowl of green vegetables, and play with your dressings. You could do hummus and olive oil. You could do balsamic vinegar. There's all sorts of ways to experiment with healthy oils and healthy fats for dressings, and chop up and put in there anything you like in terms of vegetables, nuts, beans. And if you're going to have a protein like a meat protein, then I would stick with fish, shrimp, tofu, if you have to have
So
it.
I don't ever use any bottled salad dressing. I haven't used that my
Beautiful.
adult life. I simply use a squeeze of lemon, lime, or fresh orange, and then some really good olive oil and a little salt and pepper. And sometimes I'll add in a little Dijon mustard and kind of emulsify it. It's
That
so,
sounds amazing. Yeah.
yeah.
And I think another good one is a teaspoon or a tablespoon, depending on how many people you're feeding, of hummus or
Mhm.
tahini with olive oil, avocado oil, coconut oil as your base. And then you can mix in really any spice. Mrs. Dash salt free is a really good one. And like you said, emulsify it and use that as a dressing. It's so much cheaper and so much healthier because the newest data is showing us that the lower the amount of fat in our diet, the more protective, but particularly saturated fat. So we're getting some questions here that may or may not be useful for the whole group. So
Okay.
I'm going to answer them, but I'd like people when they do ask questions in the chat to put their email in there. That way, if I don't get to the question during this talk, I can email you the answer afterwards if I don't think it's useful for everybody.
Okay.
One of the questions we just got was about what if I don't have any taste buds? And I want to answer that, just not at this very moment, because I want to make this sure this is as useful for everybody. So if Michelle could put her email in there, I'll answer that by email. Coming back to what we were just talking about with risk of recurrence, Molly, I think it's really important to talk about some foundations here. So there's really good data around sleep. So what does high quality sleep mean? And I recognize for a lot of people there are obstacles here, but I want to just outline what high quality sleep is. So high quality sleep is anywhere from 7 to 9 hours at least a night in a dark room. And it's best if that room has high quality air. We spend so much of our time in bed. I don't know if you've ever watched TED TV, Molly.
Well, I watch TED Talks, but I try not to watch TV
Yeah,
all.
so TED Talks are on TED TV. It's like their
Right. Mhm.
channel.
Mhm.
And they have a TED Talk called How to Grow Fresh Air. It's a 4-minute talk, and it
Wow.
talks about the plants that you can put in your bedroom that are really extraordinary at managing quality of air, even to the point where we can reverse COPD outcomes. So it's called How to Grow Fresh
Writing that
Air.
down.
Yep,
Yeah.
How to Grow Fresh Air on TEDTV.com. And I think it's really important to think about going to bed around 10 o'clock if possible.
Mhm.
It sort of mimics our natural internal rhythms of how we sleep, and it helps us to manage our hormones around how we use fat and sugar. So, data shows us that there's actually a significant rise in risk of breast, colorectal, lung cancer in night shift workers. So, people who are exposed to light at night. So,
Yes.
even if those people are getting sleep during the day and it's 8 to 9 hours and it's in a dark room, because they're exposed to light when they're not supposed to be exposed to light, it changes their way their bodies use fat and sugar. And that's a big driver when we're thinking about what drives cancer cell growth, particularly breast cancer. That's a big driver in breast cancer growth.
So here's my question. What
Mm-hmm,
about a sleep mask? And I don't mean like a
mm-hmm,
COVID-19 mask, I mean an eye mask. I've
mm-hmm.
been using one for a couple of months and I found that my sleep is deeper.
Oh, Molly, I'm so glad for you. I think it's huge. If you can't get night blinds and if you have no neighbors that are running their lights all night, it can be really hard to get the kind of darkness that you really need. Why do you need that darkness? Because when your brain perceives a lack of light, you release a hormone called melatonin. Melatonin is not a sleep hormone. Melatonin is a hormone that's released in response to darkness, and it's responsible for immune surveillance. So it's regulating how the body manages cell repair and cell errors.
I
So
did not know that. I thought
yeah.
melatonin was something we took to put ourselves to sleep.
No, it is over the counter. So over the counter, you can get a 1 to 6 milligram dose, and that's just like a little booster to boost your brain's endogenous or internal production of melatonin. But when we use it therapeutically, we're using 20 to 40 milligrams to actually fight cancer. So let me tell you a little bit more about what I mean there. Um, so there's three ways that we really get cancer, three big pieces, and one of them is poor immune surveillance. So every cell that's dividing in your body right now, and in mine, Molly, before it finishes making its two daughters, and those two daughters make two more daughters, and so on and so forth, it's stopped by a mechanism, an internal mechanism called border control. Border control looks at the cell and checks for errors. This is what we call immune surveillance.
Mm.
If the cell finds an error within itself, it will actually either repair it or it will actually kill itself because it'll designate itself no longer useful to you. And then those cells pieces get resorbed and reused or recycled. That's happening all day long. So as I'm sitting here, the sun may come in and hit my cheek. That causes this cell that's growing in my skin here to make a mistake. That mistake is caught before that cell regenerates two daughters that also have mistakes in them. And it either corrects or repairs itself, or it designates itself for extermination. Does that make sense?
Yes, but then it must be that some of those cells don't repair and don't exterminate
That's right.
right?
So some people don't have good border control.
Okay.
So part of border control, part of why we don't have good border control could be genes. So we know about BRCA, for example, or Lynch syndrome. Those are actually border control gene problems where you inherit a gene where you have poor border control. For some people, it could be age. So as we age, our border control is weaker. And for some people, it could be that they're introducing things like night shift work earlier in life, which interferes with immune surveillance and border control because it's interfering with light at night. Does that make sense?
Totally.
So sorry, Molly, last point.
No, I want to make sure we have time for everything. So we have about 4 minutes left, but let's go over so we can get all this answered, all these questions. Because, okay, so sleep. I just want to review this for everybody. Dark room. Go to bed around 10 p.m. Maybe set your cell phone that it gives you an alert, maybe 15, 30 minutes before. That's what I do, that it's time for bed. Make sure you get 8 hours. Consider a sleep mask. What about eating?
And consider looking at that video, How to Grow Fresh Air, so that the air quality in your room is improved at night. And have a tiny little protein snack, maybe 30 minutes to 40 minutes before bed. A little bit of oatmeal, a little bit of whole wheat bread, and peanut butter, almond butter. Just like our moms did for us when we were younger, we had a protein snack before bed. It really helps to regulate sugar, because a big piece of why sleep is so important is sleep actually regulates how we use fat and sugar. And that is why when we don't sleep, we tend to not only see our stress levels rise, but our weight rises. And that is actually a driver for breast cancer growth. So even though we don't have enough time to continue going in this talk, it would be useful, I think, at some point to sort of go over each of those drivers and what we can do to prevent them. But before we close, I want to say a couple things. One, definitely go to the website, aimnatural.com, and contact us with specific questions, or send us an email with those questions. Two, when we're in this time of this COVID crisis and we're delaying treatment, think about advocacy with your doctors and really work on your stress, breathing, yoga, meditation. Three, your diet is a powerful force in your life. I don't want you to dismiss it, and I don't want you to be afraid of making small changes. Even just introducing a little bit of broccoli into your macaroni and cheese makes a difference.
So what about just your one desert island recommendation for what we can do to lower recurrence during this time?
Yeah.
That be?
So if I just had to focus on what we've already talked about, I would really focus on stress management. The most of the data around lowering risk of recurrence and prevention is really around mind-body medicine. If you go to PubMed, pubmed.gov, and you put in MBSR, mind-body stress reduction and cancer, you'll see over 20,000 studies on how effective it is, not just in improving quality of life, but really in improving outcomes. So I can't stress it enough.
So we know that now there are lots of online yoga classes and there's meditation apps. Do you have a favorite app for meditation?
I think Simple Habit is great. It's an app that you can put on your phone. It's low stress and not a lot of pressure, but they gently remind you every day. And they even have meditations on there from 1 minute to 5 minutes that you can easily work into your day. But I think the best one for me personally, there's two. Healthjourneys.com, we talked about this last time, has a list of guided meditations specific for cancer patients that I think are really effective. And The Soul of Healing Meditations by Deepak Chopra, which you can get off of Amazon. The first three tracks are on resentment. And I think resentment is such a breeding ground. Yeah, it's such a breeding ground for what we hold on to and what drives inflammation in our cell microbiology. So I'm just going to go over those one more time before we close. Healthjourneys.com. Look for their cancer series. Simple Habit, it's an app you can put on your phone, or The Soul of Healing Meditations, the first three tracks on Amazon.com.
So before we end, I'm just on a personal note going to share that 23 years ago, I went through a emotionally, mentally, physically, and financially devastating divorce. And I held on to resentment for a long time. And I think that that might have been part of what contributed to my breast cancer. I'm not sure. I'm not blaming it on that. But the minute I gave that up, everything changed for me. So I'm going to definitely, I don't feel resentful anymore, but I'm going to definitely look at that app. And thank you so much, Dr. Roy.
Molly, I love transparency.
Oh, yeah, well, why not? Isn't that Brene Brown says vulnerability is the birthplace of creativity?
She sure does.
Yeah. Mm-hmm. So you're in Michigan and we have a national audience. If people contact you anywhere in the United States, is that okay?
Yep. So we see patients over telemed, or we'll direct them to someone in their area if there is someone who's board certified in integrative oncology. You really should be seeing someone with the letters FABNO after their name, and you shouldn't be in oncologic treatment without seeing someone with the letters FABNO after their name, because that person can really help guide you through all of this and get the best of what's integrative care. So the best of conventional medicine in conjunction with complementary care.
Perfect. So think about FABNO, Dr. Roy, and AIMnatural.com. Go to the Pink Fund in a couple of days. We'll have a downloadable document about what we've discussed. And Dr. Roy, we look forward to speaking to your colleague, Dr. March, about nutrition. I'm trying to see what she's on our schedule. I think we're getting her on in a couple of weeks. But thank you again. Have a great Thursday evening, and all the weekend is coming up.
So, yeah, be well. It's been an honor. Thank you, Molly.